When we first get that call, as the tones go off, we get the adrenaline rush, wanting to get to the call as soon as we can.
You start immediately racing through your mind what you're going to do, what you might have, all the scenarios, just hundreds of things are going through your mind en route to that call.
The golden hour is when 911 call comes in and until we get that patient to surgery. Time and information is very vital to allowing the patient to live.
Survivability increases within that golden hour. After that, the chances drop off significantly.
Every second counts. Dealing with trauma patients, the more information we can get from them and about the case can give the trauma surgeon a better chance to give them a better outcome.
The Samsung ultrasound helps us see things that we normally can't see in a trauma patient.
In one cardiac case, we had a rhythm on the monitor, but were unable to detect a pulse. By using the Samsung ultrasound machine, we were able to verify that rhythm. If we were not able to use the machine and confirm the rhythm, we would have had to call our medical director and ask to stop resuscitation efforts.
Rather than call me to pronounce the patient over the phone, they reached for the ultrasound and saw that the heart was still trying to contract to save itself. And they unleashed the whole resources of the ambulance to try and resuscitate this patient. And they got a pulse back.
Samsung ultrasound and Trice imaging together have solved a major problem that ultrasound in the field has encountered in the past. The images being able to be transmitted and time of transmission.
It allows the physicians to see real-time images of what we see. They can start preparing. If they need to go straight to the OR, they're straight to the OR.
Our department responded to a stabbing incident. The patient had a sucking chest wound. We utilized ultrasound.
The ultrasound showed that the lung had collapsed. We were able to put a chest tube in a very timely fashion versus get a chest x-ray, see what was going on, or even do an ultrasound in the trauma bay. All of that had been done before and we could treat it right away.
We had a trauma patient that was complaining of abdominal pain. We actually used the sonogram machine and found that there was free fluid near the liver, able to transmit those images real time to the trauma center. At that time, they were able to get ready for our arrival.
In both of those cases, if we had not had pre-hospital ultrasound and the transmission of that pre-hospital ultrasound, we would have had a longer stay in the emergency department while we figured out, do we need to go to the ER, do we need to go to CAT scan, do we need to go to the operating room, and what else do we need to do to stabilize that patient?
Knowing that the physician is laying eyes on what we're looking at is huge. It takes a lot of pressure off of us because we know they're the key to helping this patient have a good outcome and ultimately saving time, saving lives.
People ask why we get excited. We get excited because it's what we love to do. We love to save lives, to help people.
The measure of our greatness, I'm telling you, is not in saving those lives that everyone else can save. Our greatness is measured in saving those that no one else can. This is my duty, and this is my duty of my paramedics. Great men and women, paramedics, that are passionate about what they do in saving lives. That's who we are.